This film is going to show how the Ava Board will help you to work with assessment function regarding patients with hand injuries and illnesses affecting the hands. The target group consists of occupational therapists, physiotherapists, nurses and doctors working in care centers or hospitals.
The Ava Board is a pedagogical visual instrument of assessment. It is also an inspirational aid for training of the hands for both patients and instructors.
The patient is placed in focus and becomes more participating in his own treatment and will easier reach his purpose by conquering the problems which limit the ability to move.
The Ava Board is tested according to its reliability and validity. The name is an abbreviation of E as in easy, V as in visual, A as in analytic.
The clinical experience of the Ava Board is that it contributes to make it easier for the patients to start the natural moving pattern of the hand, as the patient is able to see his dysfunction and to understand how it affects the hand.
The attendant can, on the same time, already at the first consultation, easier explain how the patient must carry out the exercises.
The Ava Board is a quantitative evaluation instrument which measures functionality in millimeters and degrees.
With the help of the Ava Board, you are able to measure the full hand grip, the different opening grips of the thumb, the movability of the fingers, the hook grip and the size of ganglions and cysts with the help of 8 cylinders, 12 sticks, 4 discs and 5 splints. All of these are collected into one Ava Board. We will now demonstrate the use of the Ava Board on patients with different diagnoses. Fist diastasis is about testing the cylinder grip. We shall notice how the patient manages to encircle the cylinders with all the fingers.
Fist diastasis is a measure showing how many millimeters there are left for the fingers in the maximal flexion to be able to reach the palm of the hand.
As the material is transparent, the grip ability and the fingerprints will be noticed in an optimal way. In this case, the Ava Board measures in a more reliable way than a goniometer, as the patient clearly feels if he is able or not to clasp the cylinder with the maximal flexion of the fingers. The range of measurements will be documented in the patient's casebook.
The aim is to identify the activity limitations of the hand, and the purpose is for the patient to practice the cylinder grip and, for example, be able to hold an empty glass, a shower handle and an electric toothbrush at the start of the treatment.
The optimal aim is to enable the patient to roll the cylinder forward and backward in the hand, which will give the fingers maximal gliding of the tendons and a normal flexion. For the identification of separate fist diastasis of the fingers, we want to note how the patient will manage to reach a round stick placed in a right angle position towards the distal curve of the palm. Even here, the Ava Board gives a more accurate measurement compared to measuring with a ruler, which easily cuts into the skin with a varied pressure.
If all the fingers are affected, we recommend that you start by first measuring the little finger with a stick, which is placed in the distal curve slightly radial, as the little finger, when flexed, will be radially deviated. When you measure the index finger, the stick will be placed slightly ulnar, as this finger in flexion will deviate that way. If only one finger is affected, only this finger will be measured.
The aim of the training is to identify the incapability of functioning regarding the fingers with the purpose of motivating the patient to furthermore increase his movability through exercising and activity. The optimal aim is to enable the patient to perform a maximal tendon gliding of the wrist and the fingers. To identify a thumb opposition, the patient will show how he or she will manage to reach a round stick placed in a right angle direction against a distal folding curve, DFC, at the base of the little finger by maximal opposing of the thumb.
The aim is to identify the limitation of the movement of the thumb, and the purpose is that the patient will be motivated as to furthermore increase his movability and practice joint-by-joint exercises, pinch grip training and training with a dough.
Identifying distal fist diastasis by hook grip will show how the patient is able to enclose the disc with all the fingers of the hand. When measuring, we will find out how many millimeters there are missing for the outer joints of the fingers to, by a maximal flexion, reach the MCP fold of the joint with straight MCP joints. Even here, the Ava board gives a more exact measurement compared to measuring with a ruler. The patient will manage or not manage to enclose the disc with the fingers.
The purpose is to identify and find the exact joints of the finger and be able to notice the limitation of movement, and so make the individual to understand the value of exercising flexion and extension in the hook grip position.
When identifying the extension defect of the fingers in the PIP joint, so-called extrinsic extension, the splint is applied on the volar side of one finger at a time.
Extrinsic extension involves a stretching in the PIP joint with an extended MCP joint, which often leads to overstretching in the MCP joints, and a non-optimal extension in the PIP joints when long extensors makes the movements.
To avoid hyperextension in the MCP joints, the dorsal side of the hand is placed against the tabletop. In this way, the MCP joints are kept straight and a measurement of an isolated PIP joint extension will be managed. The patient must manage to extend in the PIP joint with straight MCP joints and with the dorsal sides of the fingers against the tabletop.
The purpose is to identify an extension defect in the PIP joint and to be able to see and learn how an effective extension exercise could be performed.
Identifying extension defect of the fingers in the PIP joint with flexed MCP joints. When measuring intrinsic extension, the splint is applied on the volar side on one finger at a time. Intrinsic extension means stretching of the PIP joint with flexed MCP joints. The intrinsic muscles then make the optimal extension in the PIP joints. The dorsal sides of the fingers are placed against the top of the table and the MCP joints are kept in 90 degrees. In this way, an isolated PIP joint extension can be measured.
The purpose is to identify an extension defect in the PIP joint and to be able to see and learn how an effective extension exercise should be performed.
Identifying abduction of the fingers. By measuring the abduction of the fingers, we want to see how much, for example, the little finger and the ring finger will manage to abduct with the help of the cylinders.
The purpose is to identify the abduction limitation and regain normal movement through exercise.
The next measurement is the identification of the opening grip of the thumb. We want to notice how the patient is able to manage clasping a cylinder close to the skin fold between the thumb and the index finger.
The purpose of the test is to identify the dysfunction and limitations of the thumb. The objective is to regain a normal opening grip by training and activity.
To be able to identify the radial abduction grip of the thumb, we want to see how the patient will manage to clasp a cylinder close to the skin fold between the thumb and the index finger with the palm of the hand facing the table.
The purpose with this test is to identify the functional reduction of the thumb as well as the activity limitations, hoping to regain a normal opening grip by exercise and treatment with arthrosis.
On a newly discovered ganglion or a cyst, there are possibilities to measure the size by using the inner measurement of the cylinders. The first time you measure, the diameter is perhaps 25 times 25 millimeters, and the second time the ganglion might have decreased to 15 times 15 millimeters.
In the case where the patient has a mallet finger, you might have a rather scared patient in front of you. A patient who has been immobilized and for the first time in 6 weeks is going to find out if she is able to bend and stretch the outer joint of the injured finger. You stabilize the medium phalanx of the injured finger and ask the patient to bend and stretch 3 times. Most often, full flexibility and stability is reached.
You continue by letting the patient clasp a 60 millimeter cylinder, and it is by great effort the patient is able to manage his challenge. Thanks to the transparency of the cylinder, the fingerprints clearly show how the outer joint is able to bend and then stretch again. The patient is asked to continue clasping the 50 millimeter cylinder and thereafter the 40 millimeters.
The patient is encouraged to bend the injured finger inwards with great care a few times a day, and then to continue according to the program given earlier.
After 8 weeks, you repeat the test with the cylinders again.
The benefits of this treatment has been it's non-invasive. It's totally up to me. The exercises together with Eva and the support from Eva has corrected my finger, and I'm now completely pain-free, and I have a total full mobility of the finger and the force.
The Ava Board may be used for many different diagnoses. Fractures of the fingers, distortions of the fingers, fracture of the radius, SHF-syndromes, Duyputren's contraction, stroke, rheumatic arthritis, arthrosis, trigger finger, injury of the thumb, injury of the tendons, mallet finger and ganglion. Here we want to present a case. Anna was struck with a fracture of the base phalanx of the ring finger on the left hand and had an operation with a pivot in August 2013. After the surgery, she had a POP for 4 weeks.
After 6 weeks, she came to me for treatment. At the beginning, she was very stiff, in pain, and very sad.
Anna was clearly unable to find the flexion in the DIP joint because of the scar tissue, which had grown between the different layers of skin and tissue. She did not manage to clasp the 60 millimeter cylinder with her ring finger, but with her other fingers. Already after 2 weeks with the Ava Board's activity and training programs, she eventually managed to clasp the 60 millimeter cylinder with all fingers.
After 6 weeks of hand rehabilitation, she was able to clasp the 40 millimeter cylinder. Anna, who is a competitive kind of person, is now happier and continues with a fighting spirit. After 15 weeks of training, Anna was able to clasp the 25 millimeter cylinder. She still managed to reach the 25 millimeter stick and now succeeded in clasping the 20 millimeter disc with all the fingers because of improved movement in the PIP joint.
After 23 weeks of treatment, she was ready to clasp the 15 millimeter cylinder, to reach the 10 millimeter stick and to clasp the 10 millimeter disc. The finger abduction between the ring finger and the little finger when clasping a cylinder was 20 millimeters on the left hand and 25 millimeters on the right hand.
During my rehabilitation, I came in contact with the Ava Board. It helped me to see my progress in the rehabilitation and triggered me in continuing with my own rehabilitation.
The Ava Board is a good facility for both assessment and treatment. It's easy to use and gives the patient clear information both visually and practically. It's easy to use, cleanse, and it's aesthetically attractive. We strongly recommend the Ava Board.
Similar judgments have come from many other occupational therapists, colleagues from all parts of Sweden.
When I got rheumatoid arthritis, the joints of my fingers were swollen and aching. I was much helped by being able to clearly see the improvement. There was always some little thing that I could do, reach, with my finger. The Ava Board is also beautifully designed, which makes it even more fun to use.
The Ava Board is functioning as a very good complementary to the goniometer and to the ruler. It is an excellent aid for assessment as well as for training. It does not take long to effectively measure the hand. The patient is given distinct information visually and practically.
The purpose of this film is to give a deeper knowledge about the Ava Board, how it may be used every day, and its usefulness relating to my own experiences.